Hello everyone and welcome to this 5 Lives podcast. I'm Malika Dabat from 5 Lives and we're honored today to host Professor Miia Kivipelto. Miia is a professor and researcher at the Karolinska Institute and Imperial College London. She's a key opinion leader in the field of dementia and Alzheimer's disease research. Professor Kivipelto is also the principal investigator of the FINGER study, a major 2-year multimodal intervention which is a pioneer study in the field of lifestyle interventions for dementia prevention. She's a specialist of those topics and we're truly excited to talk to her today. Welcome, Miia. Could you please introduce yourself for our listeners today?
Hello, my name is Miia Kivipelto. I'm professor in Clinical Geriatrics at Karolinska Institute, Stockholm, Sweden. I'm medical doctor and geriatrician and work also at the Karolinska University Hospital. Part of my position is in Finland, where the FINGER study also comes from, as well as Imperial College London, where I'm heading the AIDS unit.
Thank you, Miia. So almost 10 years ago, your group launched the FINGER study, which included a 2-year interventions program focusing on multiple domains such as diet, exercise, social activity, and many more. This study demonstrated the benefits of those lifestyle interventions on cognition among older adults. It was a pioneer study in the field of dementia prevention. Could you please tell us a bit more about this study?
Yes, the FINGER study is the first large, long-term randomized control trial to show that it's possible to prevent cognitive decline among elderly persons from the general population. So we started the trial 2009 after there had been a lot of evidence from epidemiological studies that there are many lifestyle-related risk factors for dementia and Alzheimer's disease. However, it has been very difficult to verify these epidemiological studies in randomized controlled trials. And why randomized controlled trials are so important is because that's the highest level of evidence what we can get in the research. So it's important to verify the observations conducting this type of trials. But the earlier studies have not been so positive. They have been often single domain studies focusing only on some of the modifiable risk factors. So what we did in the FINGER study for the first time was that we combined all lifestyle factors. So the name FINGER reminds us about the 5 fingers. It's like one hand and 5 fingers. So we had the physical activity, 1 finger, healthy balanced diet, the 2nd finger. Then comes the cognitive training or mental activities, keeping the brain active. The 4th one is the social activities and relaxation. And the 5th one, taking care of all vascular and metabolic risk factors like blood pressure, lipids and cholesterol, diabetes and obesity. So targeting different risk factors at the same time, that's what we did in the FINGER trial.
Wow, so that's very interesting. So to better understand, could you tell us a bit more about the interventions being investigated in the FINGER trial?
So in the FINGER trial, we had indeed this combination of 5 different domains, because we believe that you need to target several risk factors and mechanisms at the same time to get the optimal preventive effect. It's not enough to only focus on 1 or 2 of these risk factors. So we had these 5 domains: physical activity, healthy diet, cognitive training, social activities, and taking care of all vascular and metabolic risk factors. And that was compared to the regular health advice what people normally get today. The intervention was for 2 years because we have also learned that you need to have enough time to show the benefits for the brain health. And the participants who were included for the FINGER trial were healthy elderly persons. The age was 65 to 77 years, and they had some risk factors present when we started the trial. They could have, for example, high blood pressure or low physical activity or, for example, obesity.
And was there an intervention that stood out from the others in the study? And which intervention would you say is the most important?
I would say that it's not one of these interventions, it's really the package, all these 5 fingers together, because we need to take care of different risk factors and mechanisms And when we do all of these, the package, there is an additive and synergistic effect. So I would say that try to activate all these 5 fingers every day. It may also be good if you find activities where you have different type of aspects or fingers at the same time. One good example is dancing, because when you dance, it's physical, it's social, it's a bit mental because you need to think how you are dancing, and it's also kind of relaxing, and there's the music. So you could find activities where you combine different fingers at the same time. I think for the future, we are now moving from the complexity to precision prevention, meaning that we all have our risk profiles. And maybe if you want to start somewhere, it's good to think which of these 5 fingers I have most challenges with. Is it the low physical activity, or is it maybe the stress and sleeping problems? So start with the finger and that activities where you feel that you have most kind of challenges with at this.
Could you maybe walk us through the main findings of the finger study and what we can conclude from this?
So the primary outcome in the finger trial was cognition and memory. And we could show for the first time that the lifestyle-based multi-domain intervention can prevent cognitive impairment. We could see that this finger group who received these 5 different domains had around 25% more improvement in the total cognition, like all different type of cognitive domains. And we could see the same pattern for all cognitive subdomains. For example, executive function, how we are planning different things, or multitasking, how we are planning to do something we want to do. That was 83% more improvement in the finger. Processing speed, how quickly we can do different things, 150% more improvement. And even memory, more complex memory tasks, around 40% more improvement. On top of that, the finger group had better functional level on the daily activities. They had better quality of life. And quite strikingly, the risk of other chronic diseases, multimorbidity, several other chronic diseases like the inflammatory disorders and other type of diseases, that risk was also reduced by 60%. So we can say that the same package, the same intervention is really beneficial for the brain health, for the total health, and even on the individual level and on the societal level, because we have been also able to show that there are clear cost benefits for the society if this kind of model could be run on the longer time.
So this study was based on the extensive work done in the past showing the impact of lifestyle on brain health. So I would like to ask you next, what is the role of lifestyle in aging?
I would say that the role of lifestyle is very important for the functioning and for the brain health in general. We have been underestimating the effect of the lifestyle for older people and for all, I would say. There has been maybe a belief that there will be a kind of miracle drug that will prevent or cure the whole Alzheimer's disease. And given how complex Alzheimer's disease is, I don't think we will get one drug, but the lifestyle is really important. I normally say it's never too late to start to prevent dementia because the process leading to Alzheimer's disease may start to develop 20 or 30 years before we can do the diagnosis. At the same time, it's luckily never too late. We have been able to show with the finger trial that you can always do something for the better functional level and for the quality of life. So indeed, I think lifestyle is really important. So it's both for the brain health, for the general health, functional level, and even quality of life.
Well, so this is very exciting and promising. I think one aspect people are very unaware of is at what age they should focus on changing their lifestyle for a better brain health. I think some people believe that they're too old and it's already too late to change, or that they're too young to worry about it. Would you say there is an ideal age for people to start changing their habits to prevent brain health issues?
That's a good question. What's the ideal age? Given that the process leading to dementia starts so early, I would say it's never too early to start to prevent. In the finger trial, we had the 60 to 77 years because we knew that this is the at-risk group. When things start to happen, people are retiring, they are losing maybe the structure when they are not anymore at work. But I would like to start even earlier. I would say at midlife, when we have lots of evidence that many of these risk factors are important. For example, high blood pressure, cholesterol, obesity, diabetes are starting to develop when people are, let's say, around 50. Or maybe even earlier, because I'm thinking younger population when you are kind of shaping your habits. So maybe starting even earlier in the future. So I would think the whole life course can be captured. And maybe we can find the right tools for each age group, how you can highlight the different risk factors, what are the challenges when you are young or when you are old, and what is needed. So I see really this as a life course approach, and the same 5 fingers can be there, but maybe in a bit different ways so that you can capture the people in the right way.
So the results of the finger study are very positive and give us a lot of hope for the future in the field. What do you believe will be the impact of this study on the general population?
I believe that finger and finger type of interventions may have a huge impact on individual level, but also on the societal level. 40% of all dementias may be related to modifiable risk factors and could be prevented. And we don't need always totally to prevent dementia. That may not even be possible, but just postponing the onset of dementia may have a huge impact. Just postponing the onset with 5 years could decrease the amount of the death of the patients with 50%. And that would have a big impact on the whole society. So everything what we can do for the better brain health, for the better functional level can really be improved. I also believe that the finger study has been giving important lessons for us. Prevention is better than treatment. And now I see clearly that both the non-pharmacological and pharmacological interventions are moving to the same direction. We are starting earlier. We don't wait anymore people to have clear dementia symptoms. So I think that's also the important message. We need to increase awareness of the brain health and the risk factors, both on individual level, but also on the societal level.
To allow for more people to benefit from those types of intervention, we need not only academics, but also industry to get involved. What impact do you think your study will have on a company like 5 Lives or on the industry in general?
I think for the future, we need to have more public-private initiatives and partnership to really scale up and implement the findings which are already available. Normally, it takes between 15 to 20 years to implement the scientific findings. For me, that's too long time. Clearly, we need to work together, have joint initiatives to really facilitate the implementation. And here I think novel solutions like new technology could help us to really increase the awareness and implement these findings. I believe that new technology can really help, for example, in the study like finger, to scale it up and make it available for people globally, not only in some studies or in some cities.
Thank you, Miia. After speaking to you today, you've given us so much hope when it comes to dementia prevention.
Yes, that's what I think is important, to give the message. There is hope. I'm much more optimistic for the future now when it comes to dementia, Alzheimer's disease, brain health. That's so important for the future on individual level, but also for the whole societies. And can we optimize the brain health with all these measures? Can we even reduce the risk of dementia? That's really having a huge impact for the societies.
And so what are the next steps for you now that the finger project is almost over?
So the finger trial has been now expanded to worldwide fingers. We launched the Worldwide Fingers Network 2017 to help and support new countries to start finger type of trials in different settings and in different populations. And I'm very happy that today we are having 45 countries from all continents who are part of the Worldwide Fingers Network. We will learn a lot maybe there will be new lifestyle factors. Maybe we will learn more about the diet, the physical activity. So I'm really optimistic for the future because of these type of new studies where we are learning. The second thing what I'm really seeing now is the precision prevention. We are all having different risk factors and profiles, and maybe in the future we can tailor this finger model so that we are more specifically capturing the risk factors which are most important for each individual. And we are also starting a very exciting new study where we are combining finger with the possible disease-modifying drug. We are starting with the diabetes medication, metformin, because that's easily available, and to really see if we can combine the lifestyle and drugs. It's not lifestyle or drugs. For me, it's really the combination. And hopefully in the future, when there are new, more specific Alzheimer drugs, that has been quite difficult area, but now there is hope even there, then we could combine lifestyle and Alzheimer specific drugs. But for me, the lifestyle is always there. That should be always the basis. And then we add new medications when needed. And then, of course, finally, the new technology. In the worldwide fingers, and because of the COVID pandemic as well, there has been a huge need to use new technology to go from face-to-face meetings to virtual meetings. So this type of concept, e-fingers, how we can use new technology to facilitate more personalized, more scalable interventions will be one of the big goals in our research. And here really all hands and all fingers are needed because this is a joint collaboration.
So this is very promising, and we can't wait to see how this amazing project will evolve in the future. For my last question, I would like to ask you what you believe the research and industry should focus on in the next few years.
I would say that finding novel solutions, moving the prevention for me is absolutely the area where we need to work together. So I think being part of these kind of big initiatives where we have a lot of data, we have the global scale is important. So prevention is one. Early detection is, of course, also an important area because if we start the interventions early enough, there is more room for the improvement. So I think that's important. At the same time, we should not forget that there will be many persons developing dementia. So we should at the same time also try to find solutions for persons who have cognitive impairments and dementia, and also creating dementia-friendly societies where we can help persons and the caregivers who have cognitive impairment.
Thank you so much, Miia, for taking the time to chat to us today. It was fascinating to hear you speak. Your approach is truly inspirational and gives us hope for the future. Do you have any final thoughts you would like to share with us?
The take-home message is that there is so much we all can do for the better brain health. We have now the scientifically proved model, the finger model with the 5 fingers. So please try to activate all the 5 fingers every day. That's good for the brain health and for the general health and the quality of life. And there is so much we can all do every day for our own health, but also for the whole society. So I'm very optimistic for the future.
Thank you, Miia, for this final hopeful message. What a way to brilliantly conclude this podcast. It has been a great pleasure to chat with you today. Thank you for listening to us today. It has been a privilege for us to host Professor Miia Kivipelto. She showed us how important it is to lead a healthy lifestyle for better brain health, and that it's never too early or too late to begin thinking about it. I would like to thank Dr. Jacobson for co-producing this podcast, as well as Virginie Marran and Tania Gomez for their contribution. We hope to catch up with you real soon on the 5 Lives podcast.